In essence, unlike an adult, a child with brain injury must begin the recovery process yet again at each new developmental stage. Therefore, a child with a TBI may display promising recovery of pre-existing basic intellectual functions and adaptive skills, particularly within the first year after injury, but show signs of later emerging difficulties in higher-level cognitive skills. Many commonly used standardized measures are inadequate to detect the cognitive linguistic deficits. For example, school-based achievement testing tends to assess verbal abilities that are either overlearned or automatic. And these are skills that are typically found to be relatively spared following brain injury, particularly in the long term. Standardized language and aphasia batteries are largely ineffective in characterizing persistent cognitive linguistic deficits after a pediatric TBI, primarily due to a focus on isolated word and sentence level measures rather than on discourse-based competence. For instance, children with a traumatic brain injury typically show recovery of the formal aspects of language expression, such as phonology, syntax, and semantics, as early as 3 months post-injury. However, many children display persistent difficulties conveying their ideas in connected language, that is, discourse, even when performing within normal limits on traditional standardized language measures, such as use of complex syntax. Isolated measures of basic language functions demonstrate little or no correspondence with everyday language functions. Discourse measures tend to be particularly informative in detecting later emerging deficits in children who have sustained a traumatic brain injury. Verbal discourse is fundamental to academic success, development of social skills, and later functional independence. Most children with traumatic brain injuries regain the ability to utilize linguistic knowledge, use appropriate vocabulary, and formulate complex sentences and discourse output, especially in the spoken modality. And this may help explain why many of the communication deficits in traumatic brain injuries go unnoticed and therefore unremediated. The Rancho scale was originally developed for adults, but a pediatric version was later developed. The Rancho Los Amigos Pediatric Level of Consciousness Scale, or just the Rancho Pediatric, is specifically designed for use with children and adolescents. The Rancho Pediatric takes into consideration how a child's responses may differ depending on developmental level. The Rancho Pediatric can be used in any setting, whether the child is in a hospital, rehabilitation center, home, or school. Knowing the child's level of consciousness, the LOC, is the key to understanding the child's cognitive and behavioral skills, and may help to determine what further assessment, intervention, and education plans may be needed.